Let's bring in now the CNBC contributor, the former head of the FDA, Dr. Scott Gottlieb. He, by the way, speaks to members of Congress tomorrow. Dr. Gottlieb, good evening to you.
Good evening.
We'll get to your testimony in just a minute, but let's reflect on what Dr. Fauci had to say to the nation today. Pretty stark warning. Death toll almost certainly higher than we think it is, and also opening too soon could bring what he called, quote, a real risk you will trigger an outbreak that you will not be able to control. What's your reaction to what Dr. Fauci said today?
Yeah, well, look, we know cases are going to go up as we reopen the nation. I think the challenge right now is we're reopening the nation against a backdrop of more spread than what we figured we would have at this stage. We're really faced with bad options here. There aren't any good options. One is to keep the economy closed for a longer period of time with all the hardship that that's bringing, including public health consequences, people missing vaccinations, missing routine primary care, not following up for chemotherapy visits. We're now seeing the public health data of the consequences of the shutdown. And the other bad decision is opening up against the backdrop of spread in a setting where you know cases are going to go up. And the risk is that we continue to have this slow simmer of infection through the summer. We might have outbreaks again. We might have growth in cases and another large epidemic. I don't think that's going to happen in the summertime. I think the more likely consequence is that we open up against the backdrop of spread. We continue to have this simmer of spread. We really don't get the cases down. And then as we head into the fall, we face a lot of risk that at that point we're going to have an explosion in cases. And so these are really difficult choices that policymakers are faced with. There aren't any good choices here.
Because many states, Dr. Gottlieb, are opening without meeting the federal guidelines, or at least the White House's guidelines, as you just said, right? Cases in many places that are opening up are still on the increase.
That's right. The guidelines specify that you want to see a sustained reduction in new cases for around 2 weeks. There's maybe 10 states that meet that criteria, probably a little fewer than that. Look, there are ways to reopen more safely. If you have in place what Dr. Fauci talked about, the track and traceability, the ability to do the case-based interventions, try to identify the cases so you have good testing in place. States are getting better testing in place now. But then have public health workers that will track down people who are infected, encourage them to self-isolate so they don't continue to spread the infection, and try to trace their sick contacts and then get those people tested as well. You're never going to catch all the cases. This is a very contagious infection. It's going to move more quickly than your public health workers can. But even if you can catch a fraction of the cases, even if you can get 15 or 20%, which would be a lot, that might be enough to prevent this from becoming epidemic again. The goal is to keep the R, the reproduction rate, under 1 so that the epidemic's contracting and not expanding. When you look across the nation right now and you look at the data, the R is about 1.1, meaning we do have an expanding epidemic nationally, and the doubling time is about 45 days. That's a big improvement from where we were. About 2-3 weeks ago, we were about 25 days, and at the outset of this, we were around 3 or 4 days. So we're showing improvement. The epidemic's slowing, but it's not contracting.
There was news early this evening that L.A. County, Los Angeles County, will stay at home until July at least. What's your reaction to that? Right decision?
Look, I think we've made the right decision in leaving these judgments up to governors and local officials who can react to the conditions on the ground, as well as the risks in their population, the density of their cities, the resources they have available to them. So the administration, by and large, has left this to local officials to manage these kinds of decisions. But we need to recognize there's bad consequences on both sides of this equation. If we open a little too soon and we see a growth in cases, that could put us in a situation where we head into a fall with a lot greater risk. But if we keep the economy shut, there's economic hardship, but then there's direct public health consequences from that economic hardship. You'll see more deaths of despair. We'll see addiction rates go up. We're seeing people miss important health care. We're seeing vaccination rates go down significantly. So we can't discount those public health consequences. These are tough decisions that governors have to make right now. I think the best we can do is, if we're going to start reopening the economy, do it slowly so that we can judge the impact of our decisions, and do it with the right tools in place. Get in place the best screening you can, and now we're limited in what we can get in place in terms of testing, but do the best you can. But we can lean very heavily on what Dr. Fauci talked about, which is the public health work of tracking down sick individuals, trying to isolate them, trying to track their sick contacts. That is important public health work, and that could have an impact here.
What do you make of the back and forth between Senator Rand Paul, and Dr. Fauci? There are many people, Dr. Gottlieb, we've heard their voices, who agree with Senator Paul's view that there won't be a surge, that it's time to open up this economy, and it's not going to be as bad as Dr. Fauci and others are warning it may be. What do you make of that?
Well, the only reason why we might not see a big surge in cases is if you believe that there's a heavy seasonal impact from this virus. We know coronaviruses are seasonal. We know they won't circulate as efficiently in the summertime. We're not quite in the summer yet. I think in July and August, you will see a seasonal effect. We will see cases start to break down, change the transmission breakdown from the heat and the humidity and the fact that epidemiology spread changes in the summer. But we really can't bank on that. I happen to believe that there will be a strong seasonal effect here, but probably not enough to fully offset the impact of the reopening right now. I mean, at best, maybe it will balance it out, but probably we're going to see an expansion in cases in May and heading into June. And then hopefully in July and August, you start to see that seasonal effect impact spread, and we do start to see chains of transmission break off a little bit. That's what we saw in 2009 with H1N1, the swine flu, where it was epidemic into June and then broke off in July. Hopefully the same thing happens here. Otherwise, I don't know what the rationale would be to believe that this is just going to magically disappear. I think the rationale would be that you think the summer is going to have an impact.
We're thinking about the way that companies are going to reopen. The CDC document we discussed last week, Dr. Gottlieb, the one that apparently the White House did not want the CDC to release, is that ever going to come out? Are we going to see those guidelines that the CDC was trying to advise the country on?
I would actually expect to see that in days. I think that document's going to come out. It's going to give prescriptive guidance to especially businesses on how to safely reopen and be specific to different kinds of business segments. It's an absolute pivotal document to have that out. Businesses will actually not be able to open in the absence of that guidance. And so I think it's important it comes out. I think it's going to come out. Based on my understanding, that document will be out perhaps in a matter of days.
You were part of our Healthy Returns event today, our virtual event. You said we're only in the second inning. That's not going to feel very comforting to a lot of people this evening, Dr. Gottlieb. Is that what you are going to tell Congress tomorrow when you testify?
Well, these are early days in this virus and dealing with this epidemic. That doesn't mean the fifth, sixth, and seventh inning needs to look as bad as the first and the second inning did. But the reality is that we're going to be dealing with this for a long time. This virus probably will settle into a seasonal type of component, a seasonal type of pattern. It's going to come back in the fall. It's going to collide with flu season. That presents a lot of new risks. And then we're going to have to contend with it through the winter and into another spring. We're not going to have a vaccine probably well into 2021. We should have it available in the fall to deploy experimentally and maybe to try to ring fence an outbreak. But we're not going to have a vaccine that we can mass deploy to actually quell an epidemic. The reality is that as the virus continues to spread, more and more people are getting it, and we are going to develop at some point herd immunity. So if you think that the virus just continues on its current course through September, till September, that we still have the same number of cases that we have now all the way to September 1st, at that point, 15% of the American population will have had coronavirus. And so this is growing. This is expanding. And the question is, what do we get to first, a vaccine or herd immunity?
We're thinking about summer activities. We're thinking about summer camps. And there are some who are even talking about whether school will start on time in the fall. And I'm wondering how we're supposed to think tonight about this increasing number of kids, of children who are being impacted and affected by a disease and the after effects of which we don't know a whole lot about. Are we learning anything new, Dr. Gottlieb, about what's impacting our children?
We're learning more about the syndrome. It looks like some kind of post-viral effect, post-viral inflammatory effect or autoimmune effect. We do see that with other viruses, Coxsackie, flu. We do see in a very low number of kids these kinds of post-viral types of conditions. But in those cases, you have literally millions of kids infected or affected by those viruses every year, and a very small number of them have these long-term outcomes. The question here is how many kids are getting coronavirus. There was a study in Science magazine about 2 weeks ago that said kids have about a third of the susceptibility to this virus as adults. So they're getting infected, but they're not getting very sick from it. So they're subclinical. They're not being identified, and they're not getting infected at the same rate. But we really don't know. NIH is undertaking a study now to answer this question. But to look at just the morbidity and mortality in New York City among children, for children between the age of newborns to 17, there were 300 hospitalizations and 9 tragic deaths. To put that in comparison to the flu, there were 174 deaths from flu for children under the age of 17 in a seasonal year, in a seasonal flu pattern. And so the question is, how many kids are getting coronavirus? I think the balance of the information tips in the direction of thinking that kids are getting the infection. They're just not getting very sick when they have the virus. And so these cases that we're seeing of these unusual constellation of symptoms post-viral probably sit on top of a big denominator. But we don't know the answer to that question, so this is speculation right now.